Hello, my name is Fernanda Lorenzo-Gomez. I am professor in urology at the Department of Surgery at the University Hospital of Salamanca, located in Salamanca, Spain. On behalf of my co-authors, I am happy to present our work regarding the results of the correction of post-prostatectomy urinary incontinence and after radiation therapy and its relationship with the device used during the first ever ICS online meeting. We would like to thank the patients and the investigators who participate in this study. Our author disclosure are listed here for your reference. Regardless of the technique used, the most frequent cause of male stress urinary incontinence continues to be radical prostatectomy. There is a high percentage of patients with continence problems, being lower those with moderate severe incontinence. Genitourinary toxicity after radiation therapy consists of acute symptoms, predominantly self-limiting, irritative symptoms including increased urinary frequency, dysuria, and/or urgency due to cystitis, urethritis, or both. The objective of the study was to know the results of the treatment of male urinary incontinence in patients who have received radiation therapy after radical prostatectomy for the treatment of prostate cancer and the factors that influence them. We developed a retrospective multicenter study of 226 patients treated with radical prostatectomy plus radiation therapy who underwent an anti-continence device implantation. Patients were grouped according to the outcomes of the anti-continence technique. Group A were those men with total continence after surgery. Group B were incontinent men after device implantation. Two subgroups of patients were also identified according to their continence status 1 year after surgery. The variables studied were age, BMI, PSA, Gleason score, prostate volume, follow-up time, concomitant disease, and the device implanted. 131 patients were continent after surgery and 1 year after, while 6 patients returned to incontinence 1 year after surgery. On the other hand, 39 patients were incontinent during the whole follow-up, while 50 patients achieved continence 1 year after surgery. The mean age was 69 years old, with a range between 59 and 82. Patients were younger in Group A. Regarding the subgroup of continence 1 year after surgery, patients who were still continent were younger than those with recurring incontinence of those who gained incontinence. There were no significant differences in the body mass index between groups. In Group A, prostate volume was higher than in Group B, and both the PSA and Gleason score were longer. The time between diagnosis of male stress urinary incontinence and corrective surgery was in average 7 years, and it was lower in Group A than in Group B. Major medical comorbidities, major concomitant disease were more frequent in Group A than in Group B, and in Group A failed than in Group A success. Patients in Group A failed had more previously abdominal and pelvic surgeries than those in Group B success. Patients in Group B have more arterial hypertension, diabetes mellitus, anxiety, and depression, and these comorbidities were more frequent in Group B failed than in Group B success. Previous prostate adenomectomy was more frequent in Group A failed than in Group B failed. Treatment success 1 year after surgery was similar. Treatment success 1 year after surgery was similar in patients treated with TOT and with REMIS, and it was lower in the patients implanted with atoms of Forbas. Some patients with atoms was rescued after volume adjustment. In REMIS device fails at the beginning, it is better to switch to artificial urinary sphincter. Male stress urinary incontinence after radical prostatectomy and radiation therapy with subretal anti-incontinence device has an initial success rate of 70% and after adjustment it reached 82%. Younger patients have a better prognosis. Body mass index, PSA, or prostate volume do not correlate with the outcome. Unlike Gleason score, longer incontinence evolution time and more concomitant disease, which are associated with failure. Thank you very much for your attention.